Hello to all. This is Dr. Sue from Purely Pediatrics. This week I would like to discuss dental care and our children. There are some good reasons to get a dentist involved with your child sooner rather than later, and I'll let you know why that is at the end of this audio. I want you to know that children at the age of 1 and up, it is recommended that we start their regular dental visits every 6 months, anytime past the age of 1. And that is something that many families aren't quite yet aware of. Pediatric dentists are just fantastic because they feel comfortable with children, and they will be able to start your child off anytime after the age of 1. Unfortunately, some of the family dental dentists tend not to be as comfortable with the younger child, so they might tell you that they won't start seeing your child until 3 or 4. But in all honesty, if that was the case, what I'd love for you to do is start off with a pediatric dentist who can start you guys on your dental relationship at the age of 1. Now, in terms of what we want to do to care for our children and their teeth, not only do we want to make sure we start setting up dental visits shortly after or at their first birthday, we want to make sure that we get involved with toothbrushing as early as we can, letting them understand that it's important to do that and letting them watch you. At the age of 1 and up, imitation is a huge mentor for these kids. So letting them see you brush your teeth, giving them the opportunity to do the same. So when you're brushing your teeth, hand them their own toothbrush, let them see what you're doing, and chances are they will want to imitate you. What I'd love for you to do, although I'd like for them to be interested in using their own toothbrush, what I'd like for you to do is just go through their teeth and brush their teeth with them until they are able to really do a good job, until they're older school age. Letting them know that they can do it themselves as well is great, and letting them also know that you're going to help them with it at the very end, and making sure that we get as much of that plaque off and food particles off as we can is always a great idea. Brushing our teeth in the morning and in the evening is a fantastic routine to get into. Many families forget that the morning time is really important as well as the evening time. So the reason why it's important to get dental involved, not just for tooth health, but as children become toddlers and they turn 1 to 2, that is a time when there are many falls that can occur. If you are set up with a relationship with a dentist and your child falls and injures their mouth, their teeth, their gums, or their lips, the dentist is going to be able to really help you manage this scenario and let you know if they need to see this little one. When children fracture their teeth or they do have a dental injury, if you don't have a dentist set up, unfortunately, what we may need to do as pediatricians and family doctors is send you to the emergency room where they can have dental see your child at that point. It's always a great idea to have a dentist set up in case you do have any injuries that occur as your child starts to learn how to walk and improve their balance as well. And dentists, if you haven't known this, they are on call 24/7, just like your pediatrician. So if you notice that your child has a dental injury, your first call should be to your dentist, and they will help guide you and direct you as to next steps from there. One other thing I want to mention with this post is that you do not have to start fluoride if you are not comfortable using that in your child that is just learning how to brush their teeth. It is a good idea to get fluoride involved in the care of your children with regard to toothbrushing as soon as you are comfortable to do so and you feel that your child can spit that toothpaste out right in the sink and take a drink after that. What I'd like for you to do is make sure you keep just a small, almost like a half a pea size of toothpaste. When your child gets to be closer even to the age of 1.5 to 2 years of age, it's a great thing to really start to use the toothpaste. But when they're younger than that, don't worry about it. Just get those teeth involved with brushing. Get them used to the routine, and that's really all you need to do at that point. So I think we covered the main things I want you to know about dental and your children. Please keep in mind, anytime at the age of 1 and up, please make that first dentist appointment. Get a relationship set up with a dentist. Pediatric dentists are my absolute favorite because they have chosen to work with children, and children can be a challenge. And you may be surprised at how well your child does with the dentist. They may not be very happy at first, but eventually they start to get involved in understanding that the dentist takes care of our teeth, and it's important to go there as well. So however you present the dentist is how your child is going to perceive it. So happy dentists, guys. Happy finding dentists. And please make sure that you reach out to your pediatrician if you need resources or places to call with regard to getting that dental relationship set up for you and your child. All right, you guys, have a great day. Thanks so much.